Hello, everyone. I'm Erin Cody, Director of Harpur Edge here at Binghamton University, and I'm excited to welcome you to today's interactive virtual salons. I'm also a doctoral student in the College of Community and Public Affairs, which we affectionately refer to as CCPA. It's my pleasure to welcome you today and to share with you some of our most esteemed faculty who will share with us some information on how we're eliminating disparities in health and education and moving the university and our community forward. So we'll let them introduce themselves.
Thanks, Erin.
Sure.
Hi, I'm Naorah Bronstein. I'm the Dean of CCPA. I'm a social worker by training, so also faculty in our Department of Social Work, which is part of our college. And I'm also the founder of Binghamton University Community Schools that you'll hear a lot about in this time together. Now I'll turn it over to my colleague, Naorah.
Hi, I'm Naorah Rimkunas, and I'm an assistant professor of community schools here at Binghamton University, and that's part of the Department of Teaching, Learning, and Ed Leadership and Social Work in CCPA. And I also direct our University-Assisted Community Schools Regional Training Center, which I'll tell you about, and that is funded through the Netter Center at University of Pennsylvania. So thanks for coming.
Okay, so I'm going to start off telling you a little bit about how CCPA faculty, students, and alums focus on eliminating disparities in health and education, and then focus some on the work we do in community schools. And Naorah will tell you specifically what we do with Binghamton University Community Schools, which is our nationally known community schools effort. So many of you that are tuning in today, when you were here at Binghamton, there was no CCPA. We just celebrated our 15th anniversary. And CCPA is essentially devoted to careers in the nonprofit and public sector for the most part. We have an undergraduate program. Some of you may be familiar with human development. We now have a bachelor's in social work, a minor in education. Most of our programs are master's programs. Social work, public administration, student affairs administration, human rights, and then a variety of masters in education. And then we have 2 PhD programs. But all of our academic units and all of our students and faculty are devoted to social justice issues, to making the world a better place. So as you know, Binghamton only has brilliant students, and so all our students at CCPA are not only brilliant, but really committed to making things better, and especially for people that are underserved in this world. If you think about what makes disparities happen today, I think most people, like if you think about disparities in health, most people think, well, you know, it's the luck of my genetics, it's who my medical providers are, but it's really your income. It's really your zip code that determines more of your health outcomes, even than your genetics and your medical care. And it's the same in education, that people often think, and I thought before I got into this work, oh, it's your IQ, and your IQ determines how well you do academically. And that's also your zip code. Your income really determines the opportunities you have, how well you can advocate, how well you can go into the healthcare system or the educational system and pay attention and do what needs to be done to be able to be successful. And that's really the work that CCPA pays attention to. Many of you that are listening today are involved in these kinds of efforts in your local communities, whether it's through contributions financially or volunteering. It may be through your local food banks. It may be homeless shelters. Many of you I know are involved in pandemic efforts and pandemic relief. And again, those are the areas where CCPA students are graduating and are leading. They're the ones making the policies for these organizations. They're the ones that are leading these organizations. And those are the organizations that are really addressing issues of disparities in our world. So today we're going to talk a little bit more about Binghamton University Community Schools, which is an example of a way to address health and educational disparities. And I will tell you, as a social worker for many decades, I think it's the best shot we have at interrupting the intergenerational cycle of poverty in this world. So I'll give you a little bit about what community schools are and then let Naorah talk more specifically about our work here at Binghamton. So many of you may have gone to schools where there was some sort of agency that had a presence at the school, or if you have children, your children may have gone to a school that had an after-school program, or a school-based health clinic, or mental health providers in the school, or a morning breakfast program in the school. And those are all examples of schooling services. What community schools do is start by doing a needs assessment in a school and in a community to see what's most needed here to support the kids in this community to be able to be successful. And then it's building out those supports. So if it's tutoring, that there's a number of students that are almost graduating, but they need a little bit of help to graduate. So then maybe instituting an after-school program, bringing in mentors to help with that. If there's a number of students, for example, that have domestic violence in their house and have nobody to talk to about that or address, maybe bringing in a mental health provider, someone with expertise in domestic violence into the school building so they can talk to that person and then be more present in their classroom. The model we use here at Binghamton University is called the University Assisted Community School Model. It was developed out of the University of Pennsylvania out of their belief that they needed to contribute to their local community in West Philadelphia. And a number of universities in the country have picked that model up. And we have a grant from them this year to actually expand that work all throughout New York State and New Jersey. And we've gotten, I'm going to brag a little bit, accolades from our colleagues at some of the leading universities in the country, including Stanford, of course, UPenn, and Duke University on the work that we've done in expanding this university-assisted community school model. The only other piece I'll say before I turn it over to Naorah is how lucky I've been to have been raised in a middle-class family and raised my kids in middle-class families so that if they needed to go to a doctor's appointment, I had a professional position. I didn't worry that if I left my job to take them to a medical appointment that I was going to lose my job or I might lose my hourly wage or that I have to catch 2 buses to get there. And so it's those kind of supports that, believe it or not, the majority of children in this country do not have. We're now at over 51% of children in this country are in families classified as low income. And so what community schools are doing is to be able to build in support so these children can succeed the same way that my children have been able to succeed. Now I'll turn it over to Naorah, who can tell you specifically how we're doing this at Binghamton University.
Thanks, Laura. So the work we do here in Binghamton University Community Schools is broad. We have local initiatives, we have statewide initiatives, and then we also have a national presence in the conversation around university-assisted community schools. And what university-assisted community schools means is that the university, in our case Binghamton University, takes a lead role in partnering with our local schools. And we've done that as a county-wide effort, which is the first county-wide effort in the country. And in doing that, we are, of course, our goal is to improve the lives of students, improve the lives of families and communities so that everyone can thrive. But these are also mutually beneficial relationships because our Binghamton University students also benefit from these relationships, and that's through their participation in these schools, their direct impact that they have in these schools, and these clinically rich experiences that they have in interning or volunteering with our community schools. We look at this as a way to maximize the resources that we have at the university and to also maximize the resources that our community already has. And so we do things like Laura mentioned, needs assessments, and we also do resource mapping so that we don't go into this with a deficit mindset. We go into this with a resource mindset and look at what does the community have, where are their gaps, and where can we fill in those gaps and strengthen those communities. We work in rural communities, we work in our small towns, and then we work in Binghamton area. And in doing this, families and communities receive an array of services through the schools, and what happens here is that these services are coordinated, and we do this through a community school coordinator that we work hard to find a great fit for each school. And this is somebody that works closely with our districts, with our school building leaders, administrators, all of the support systems in place to create a whole child, whole school environment where the needs of the students are attended to in an integrated way. Our primary work is carried out in three ways. One is through technical assistance, and we have become experts in this field. Certainly in smaller towns and rural areas, we're a complement to UPenn's work in that way, where they've been working in urban environments. And we are called upon to assist other higher education institutions in implementing this kind of work, helping districts figure out how to do this challenging work, but very rewarding work. We also have local implementation that I talked about. We're in 9 districts across our county. And much of the work that we do is in our faculty and student engagement. And I think this might really interest all of you. Students engage from across disciplines. Faculty engage from across disciplines in our work through applied research, through internships, through volunteer opportunities. And we, particularly in CCPA, are able to offer kind of real-world training, interdisciplinary training. That is what happens when students walk out of our teacher training programs, when they walk out of our social work programs. They quickly figure out that they are not going to be working in siloed environments. They're working with professionals from many different backgrounds. And through our work in community schools, we're able to offer internships and experiences that model that. We have really exciting work happening in our schools through student groups, such as around financial literacy for youth. We have after-school programs that focus on STEM, that focus on archaeology, and these are faculty interests that we've been able to link to our community schools through Binghamton University Community Schools. We work across departments. Right now we have a project with the Department of Geography where we're mapping our districts actually across the state using GIS technology. We have a new program with the Master of Public Health. We've been working with Decker College of Nursing for a long time. And so really able to network and work across the university to bring the full array of supports that the university has into our schools in the area. This is incredibly rewarding work, and it can only expand from here. We certainly don't work with every department in the university, although we would like to. And we have students who come in to volunteer from across the schools. Human development, linguistics, biology, psychology, political science, computer science. We have some neuroscience students who are volunteering in our community schools, industrial engineering, sociology, and math. It's broad. Students come in and they want to be in the community. Mm-hmm. It's very hard sometimes, right? We go to school for 4 years and we can be in our own zip code within the university and never step foot off campus. But these students want to step off campus, and we're able to link them into the community this way. And then in return also offer local students hope that they can be in a university at some point, because this kind of normalizes the experience. Like, you know, as a student, I can see a university student coming in and say, I can do that. That could be me one day. And some of the support services that are offered through our Binghamton University students are recess and lunch support that are provided to our schools, drop-in centers and mentoring where school students can come in and get support from college students or from MSW students. Mentoring, pen pals, social emotional support, mental health referrals for students and their families to services in the community. There's language support. There's homework support. Lots of after-school programs, summer programming. And then also some of the things that might be really familiar to you, those community fundraising drives, clothing drives, food drives, things like that. Those can all be aligned with our schools and bring in our university students to help with that. So there's a lot going on and a lot of exciting work, and this can only grow from here.
Oh, this is so exciting to hear about. just how the community has benefited from so much of your hard work, and I'm excited for those of you who are watching to interact with us today. So please do type in the chat any questions you have for our esteemed guests today, and I'll get us started. As you were speaking, I was interested in, are there tales of some of the interns or some of the students who've been touched by the impact of the work they're doing, or how the disparities you're starting to see them recede in some way?
Did you want to?
Sure. We have, we hear a lot from the field, and that's, and that's kind of throughout placements of our interns, and also we hear from students why they want to have a placement with Binghamton University Community Schools. And sometimes when a student comes in, a lot of times when a student comes in, right, they don't know exactly what they want to do, but maybe they have an idea that they want to impact the lives of youth in some way, but they don't know how or what that looks like. And a lot of times it can look like you have to be a teacher in order to work with youth. But what we know through Binghamton University Community Schools is that there are many ways to impact the lives of youth, and that can be through social work, that can be through teaching, but it can also be through creating these after-school programs and creating these integrated support opportunities where students kind of get a look at how they can impact youth, but they don't necessarily have to go that education route. We've had students who started out in high school and have interacted with a social work intern and have been really inspired, and then have come through our social work programs. That's very exciting, and we want to do more work with that through our teacher ed programs, kind of building pathways for students to see themselves as teachers, and then see themselves as teachers in our community schools.
Wow. I know in my own education, some of the most meaningful learning opportunities have been in the community. And I think this project, it's in a lot of different places. It's not just, right here in Vestal, New York. Could you talk a little bit about how expansive the community schools are?
Yeah, I mean, it really is a worldwide effort. A couple of years ago, we had 32 educators from the Netherlands come to learn about our community schools work. We also had the Council of Chief State School Officers, which are the essentially commissioners of education for the states. We had them come, and we had the education commissioner from Hawaii, from South Dakota, from Alaska, from a number of states. There were about 20 of them around the country come to learn from the work we're doing here. I think, in many ways, because the work has gone fastest in terms of the larger urban areas, New York City, Philadelphia, LA, Washington, D.C., that I think where we've really paved a path is with smaller cities and rural communities, and that's where we see most people coming to learn from us. And of course, while at Binghamton University we have a lot of students that are from the New York City area, we also have a lot of them throughout the state and even beyond the state that are from different communities, and I think they're especially interested in going out to Windsor and to Whitney Point, to some of the rural communities we work with here, and then students that are more interested in larger cities will be working in our Binghamton University schools. So it really is a worldwide effort that we're here giving students the opportunity to try out here, and then there are students that we've hired to actually be community school coordinators in our community, who've gone to other communities after they've graduated to be community school coordinators or work in community schools in different places, and that really warms our heart when we see that we turn students on to what we think is really exhilarating and really important work, and then they take it on and they go out and they make contributions where they are.
Oh, wonderful. I think one thing we haven't really touched on is, as a student in the doctoral program in Community Research and Action in CCPA, I'm wondering about, how does research play a part in this project? Are there faculty doing research, students, all of the above?
Well, I'll say one piece, but then Naorah really leads our evaluation here, so I'll turn it over to her. But like an example, Naorah talked about how we do this across campus. So we have one faculty member in social work whose expertise is grandparents raising grandchildren. And there are increasing numbers of grandparents raising grandchildren in the world today. And that's her expertise. And she teamed up with a faculty member in physics, and they did a STEM education program at the University Downtown Center for grandparents and their grandchildren, grandparents raising grandchildren. And they did that together so that the grandparents had a sense of, okay, this is what my grandchild is learning in school now, and wow, I really can be helpful. I can understand that. And they can see me learning alongside them and me as a resource for them. And then we had the faculty member there to pay attention to the psychosocial issues that were going on to make sure that the grandparents and the grandchildren felt comfortable. And then they did an assessment of that together, of both the learning, what kind of outcomes of learning came, as well as what kinds of empowerment came for the grandparents to feel like they could actually be able to help their grandchildren in this work. But Naorah can talk more generally about more that we're doing in evaluation.
Sure, and I did want to mention the work of a couple other faculty members. One who is doing work, she's a TLEL professor and has NSF grants, and she's brought that work into our community schools, doing archaeology work, and then also maker spaces, which is really about trying to engage youth and their families in talking about science in the home in a way that's accessible and in a way that then students can imagine themselves becoming scientists and becoming architects and archaeologists and chemists and biologists. And that work is generating research. That professor is also gathering socio-emotional learning data from that, as well as how these students perceive themselves as both learners and then future creators. And so that's just one way. We do have an initiative-wide evaluation that I lead, just trying to understand how are we moving the needle, right? How are we how are we improving the lives of our students and communities, and how are they thriving? And as you can imagine, these kinds of initiatives are challenging to evaluate. There's a lot of people working across the college making these happen. And so one way that we do that is we work closely with our community school coordinators to kind of track what they're doing daily and how that aligns with community school pillars or characteristics, as we call them, to try to understand where is the most need in our districts. And we find that it's a lot around family engagement. And that is something that we've really led the expertise in the area around, and it is something that is an ongoing challenge. And so we try to meet that challenge, but it's a data-driven response. Some of our schools are a little bit more concerned about how supports are integrated throughout their schools and are having trouble getting their students and families to appropriate medical help. And so by knowing that, because we're able to understand what our community school coordinators are focusing on, we can then try to help direct resources in that way. We also look at broadly the work that we do with technical assistance, for example. We try to understand what kind of impact is that happening? What kind of impact is that having? Are more programs popping up? That's what our goal is. We want to facilitate growth around community schools. And so we work closely with our partners to see where is there growth in New York and New Jersey, what institutions of higher ed are really signing up for this and doing this. We work with strategic planning, and by looking at all of that, we can then say our work has been effective, or we need to work a little bit harder in this area or that area.
I think the outcome measures that we're looking at in terms of the academic measures are measures that programs that have been doing this even longer than we have, some that have been engaged in this work 20 years, are seeing vast increases in graduation rates. We're seeing increases in attendance at school. Now, of course, the pandemic put all that into a very messy situation, but pre-pandemic we were seeing increases in attendance, and I expect once we get people back to school in a more regular way, we'll be seeing that again. Community schools around the country that have been doing this longer than we have are starting to see increases in academic outcomes. And that's ultimately what we're looking for. We want more students to be able to graduate, and when we talk to families, even families where no one has ever graduated from high school, you ask these parents, what do they want for their children? And they say, I want them to graduate. I want them to have choices in their lives that I didn't have. And so we want these students to be able to graduate. If they want to choose a career, if they want to choose college, if they want to choose a trade, whatever it is, we want to be able to facilitate that and support that so that they can be healthy members of their communities. And one of our goals is to increase economic impact in communities. And we strongly believe, and we see the data starting to come in, that we have more students that are graduating, that there's more economic impact in communities. And again, not all these students will go to college, and that's perfectly fine. We want them to be able to choose and to have be productive members of society and feel good about themselves and what they're doing.
Absolutely. Absolutely. There's so many options for people in this moment. And you mentioned the pandemic. How did the pandemic change the work, augment the work? How did you respond to the pandemic?
Yeah, I think one of the fun things that we saw, our Binghamton University students are so creative. So some of the students who were working at one of the rural schools, when school closed down, well, a lot of the students in the schools were getting their meals at the school. And so the school goes down, and where were they getting meals? So the school, this was a rural school, was packing up meals, and this was in the days when we were even afraid to go close to anybody. We just didn't know how the virus was being transmitted. And so some of the students developed some sort of like remote control car where they'd put the lunches on the cars and they'd send it over to the families so the families could take the lunches and then they could go back home with their students. Did a lot of like virtual drop-in centers. These students, as they move forward, were doing their classwork on Zoom, and so our students were doing social emotional supports with them on Zoom and doing homework help via Zoom. So we also worked to help the students who didn't have computers be able to access computers. So it was really, we went into quick mode of, okay, the world has changed now, and we don't want anything to drop for these students as much as possible. So let's see what supports, again, we can get to them that they may not have that some of their peers may have. I don't know if there's anything else you...
Yeah, and to expand on that, part of the reason we were able to respond, or the schools were able to respond that way, is because of the way that community schools operate, which is that they are collaborative organizations. That is the role of the community school coordinator, is to already have in place supports to reach students, to reach families, so that we could actually be responsive rather than reactive in that moment. And that was seen nationally during the pandemic, that community schools were able to respond really well because the relationships were already there. And not only the relationships with families and students, but relationships in the community. And so as we're looking for COVID tests, or as we're looking for computers, or as we're looking for food to be distributed, we already have those relationships set up with those community organizations. The other piece that became very important, and that was alluded to, is just that attendance was all over the place. And what got concerning is that students stopped showing up, and the question was, why are they not showing up? Is it a technology issue? That's solvable, but is it something else? And because the relationships in our community schools are different, where you have teachers and social workers and administrators and our community school coordinators really working side by side with their eyes on the students, where we could go and find out where are these students, and is there an extra step we need to take to pull them back in, just to know. And so hopefully we were able to have less students fall through the cracks because of these relationships that we already had in the schools.
Wonderful. You know, one thing that we've talked a lot about, the coordinators and the faculty and the Binghamton students going into the schools. I'd love to also hear about our partners who already work in the schools, the superintendents, the teachers. What do they say about the work of community schools? What are they telling you about it?
Yeah, I mean, I had a really fun time a few years ago. It was right pre-pandemic, and Luann Keita, who's the executive director of our Binghamton University Community Schools, and I were invited to one of the school districts to a board meeting to talk about becoming community school. And somebody on the board said, well, this will put something else on our teachers. Our teachers are overwhelmed. We really can't add something else to them. And lucky us, the head of the teachers union in the school was in the audience, and she stood up and she says, please make us a community school. I need the help. I have more than I can do in my classroom. I know how to teach, but I'm having kids come to school hungry. I'm having them come with mental health needs. I'm having them come with things that I can't attend to that get in the way of my teaching. Please let us be a community school.
Wow.
Yeah.
Wow, I got goosebumps from that because I see it here with the students that I work with, just all of us are healing from this pandemic time, and I can only imagine what you're seeing in the community schools with our younger students who, while they are resilient, I think we're going to see some additional needs in the classroom for sure. Yeah. So we remain available to you if you would like to ask some questions in our interactive chat. We have some time left together, and so I welcome you to submit any questions that you have. We really want to make sure that this is as interactive and engaged as possible, because that's what we're about at Binghamton, is having a two-way conversation. So while we wait for some of those questions to come on in, maybe you can tell us a little bit more about, you know, what you see in the future. What do you see in the future for community schools? Is it, what's going to happen? What could happen?
Well, there's a lot of support for community schools at various states. Certainly there is in New York State, there has been in New York City, and at the federal level there's increasing funding coming to develop community schools. But it's a big effort. There's lots of schools in this country, and to make them all community schools is a big effort. But we see that as the goal. We see that as providing support so every single student in this country, in this state, in this world has the opportunity to be successful, and that things like income and other variables like race, religion, ethnicity are not holding them back because of those characteristics. And we really believe and have seen that community schools are one of the primary ways to address this. So I only see it growing. And it's very exciting for us at Binghamton University to really be at the heart of that. You know, now I've got 16 people that are working on grants for community schools, and so we see that growing. And pre-pandemic, we had over 500 Binghamton University students working in the local community schools, volunteering and interning, because they're incredibly interested in this work. And as Naorah said, we can use people across all majors. If you're studying foreign language, we've got students that speak those foreign languages or learning those foreign languages that you can go in and tutor them and help them. We had in our earlier days, we had Decker School of Nursing students going in and doing diabetes education for parents. So I think the needs are great, and Binghamton University students, faculty, and alums are rising to the occasion to do everything we can to contribute to moving it forward.
Yeah. If any of our viewers today are parents of a current student or prospective students thinking about coming to Binghamton, and they think they might want to get involved with the community schools, what would be their easiest path?
Well, we do have a website, Binghamton University Community Schools. We have a video. It's a little outdated. We're working on updating it because we're moving very fast. But they can certainly also reach out to me, reach out to Naorah, Luann Keita, who's the executive director. Again, there's lots of us here that are very passionate about this work. And so we're happy to talk about it, and we're happy to talk about ways that anybody could be involved.
Yeah. You know, we have talked thus far today about education in a heavy way, but maybe not as much time given yet in our conversation to the health disparities. But you kind of touched on it with the Decker students. Could you talk a little bit more about how the community schools works toward minimizing those disparities?
Yeah, absolutely. I mean, you know, a lot of community schools will have school-based health clinics. So I think, so for example, I had children that had asthma. If they were having asthma, I would stay home with them because they need nebulizer treatments. You know, fortunately, again, I was raising my kids in a middle-class family. I was able to, you know, get the homework that they needed, help them with their homework, get in a tutor if they needed a tutor. A lot of kids don't have that opportunity. And so if they, for instance, are having, have asthma and they then they're home, and it may be an older sibling that needs to miss school as well to stay home with them because parents need to be at work to make their hourly wage or to be able to pay for their rent. And so when there's a school-based health clinic or at a school, then you can send your child to school and you can feel like, wow, they're going to get the care they need. If it gets serious, then I can get called. But if they just need to go and twice a day get a nebulizer treatment, they can go to their classes, they can go over, get a nebulizer treatment, go back to school and not miss any school. There's also a number of community schools that have transportation systems so that a student can go and get their health care, if they're on, you know, for instance, if they have ADD and they're on medication for that, they can go and get their, you know, whether it's a bus that the school has or other type of transportation, go and get a med check that they need and then come back to school. Or may have that, you know, a psychiatrist into the school, you know, once a week or once a month that can be able to do that kind of work. I mean, there are community schools around the country that have orthodontia services on the school ground donated. I was introduced to this work originally in Miami in the 90s, and we had immigration services on the school grounds. So I think, again, whatever the needs are, and if they're healthcare needs, then what we do is either bring the resources into school for that or make the linkage and enable the linkage, because it's all about access. It's about students being able to access what they need to be able to be physically and emotionally healthy and ready to learn.
Critical. If you're not healthy, you can't raise to whatever the teacher's trying to engage you in learning. Absolutely.
Right. I don't know if this.
Yeah, there's a really great example from one of the rural schools that we work with. It's outside of Broome County, but they did not have a hospital or a clinic really nearby that could really service the community. And so what you had was a lot of illnesses going undiagnosed. You had kids who were sick, but there was not, you know, there was not really a doctor available. And the answer to this was to use the school, and this is what we talk about with community schools, is that the school really becomes a hub. It becomes a center of community activity, because it's a building that is open for a certain amount of time, but why not open it for expanded services? And so with the school that I'm talking about, what they were able to do was work with a doctor who was in the area but just not close, bring in the technology for that doctor to then Zoom or FaceTime in and work with the school nurse to actually facilitate appointments. And the doctor could work with the nurse could communicate really effectively about what she or he was seeing, and then the doctor could offer you know, some kind of diagnosis, or at least make a referral, or at least get the kid in the system in some way to facilitate a diagnosis. And so the school kind of became almost like a medical outpost. And that is really creative thinking, and that is what happens in our community schools when we're able to think about the school as a hub. Some community schools offer adult learning classes, language classes, English as a second language, for parents or grandparents, as we talked about, who may not be able to get into, there might not even be higher education nearby, but to really try to facilitate, based on needs, resources that can be utilized. And so really kind of thinking about the school differently can kind of help, I think, all of us envision what this can look like. And I also just kind of wanted to jump back to, what does this look like in the future? And I think the medical outpost piece is a good example. But we also have, and for those of you who are parents of students who might want to be teachers, who might want to be social workers, we have our teachers union in New York fully invested in community schools. They are seeing community schools as the future. They are seeing it not only as the future for students and communities, but for the turnover that we see with teachers, because these schools offer additional supports for teachers, because teachers feel like they're not at this alone. We've often talked about teachers or our school social workers as kind of on the front lines, because they are the ones who are working with students. They see students daily. They sometimes know if something is a problem before anyone else does. And it can be just a really hard reality. In community schools, those professionals, those school-based professionals, are supported because they are all talking. They're talking in teams. They're talking to administrators. They are talking to community organizations. And so they're able to get these supports in, which can be truly rewarding on one side, but also just increase your commitment to the school and to the experience. And so we can address teacher turnover through community schools. That, that's all part of what a systemic kind of school change program looks like. And so when you have the teachers unions behind this as well, you can really see, and additional federal funding, you can just see that this is where people are placing the future of schools.
Yeah, and there has been, you reminded me, Naorah, data on teacher retention, which has increased a lot when there's a community school there. The other piece, because there's a few things you said that jogged me in my memory, both about the question about healthcare and health disparities, as well as the future. And we've done a lot more with telehealth as well as telemental health, especially during this pandemic. And that's proved to be, really wonderful.
Yeah, and you both kind of touched on the impact on families that the community schools has the power to have, which I think we don't often think school and the impact on families. We think school and the impact on students. But could you talk a little bit more about, are the families brought into the school? What's happening with families?
Right. Yeah, and it's even more than families. It's entire communities. I mean, many community schools are open not just from the 9 to 3, but are open, at 7 in the morning until 9 at night and on the weekends. There's schools even locally that have laundry facilities in the schools, and families can come and use the laundry facilities while their kids may be playing basketball in the gym. There are community schools that are really open and serve, even that have health services, serve the whole community, whether or not you have children in the school or not. It's, as Naorah said, they become the hub of the community, that the schools, rather than just the 9 to 3, 5 days a week during the academic year, they are the place that families and community members gather for support, to be together, to work on community issues, to get resources, to give resources, and to share.
Wow, that can be really transformative, speaking to the elimination of these disparities, because you're not just working with the children who are needing to come to school every day, you're working with their families.
Right.
That's a core tenet of community schools, is family engagement and collaborative leadership practices, meaning families are also participating in decisions about about how their schools are operating. And one thing that we've seen over the years is that some families, some people have had unsafe experiences in schools. People who have been historically marginalized have maybe had bad experiences in schools. And so as parents, when they're called into something like a parent-teacher or a student-teacher conference or a parent-teacher conference, there can be fear around that. There can be real memories of those being bad experiences, and a community school aims to welcome families in, welcome the community in, and create an environment that is safe, that we're not just hearing what bad is happening with your student, right? We also want to hear about what is the good happening, and turning the bad into opportunity. We don't really even talk about what's happening bad with students, right? And that this is really important in changing and adjusting what the feeling is in that school, and what it feels like to be in that school. And also kind of moving beyond this idea of like parent contact, or kind of moving beyond the PTA to real parent engagement, where if a parent can't make a meeting, we have to think about, well, is that because we only offered times between 8:30 and 3 and potentially they couldn't get time off to come to that meeting? We have to think beyond that and think about expanding those hours, expanding locations, looking at transportation, about how are parents able to get to the schools, and maybe we should meet somewhere else. And so thinking creatively, engaging with parents, going to parents, really pulling families in, and that is really addressing those disparities that we talk about, because those disparities can very much happen in the schools, and schools can recreate that. And we look at community schools as a real equity strategy to address that.
Yeah, one of the programs that we developed in collaboration with families, and again, these were all family members who none of whom had graduated high school, developed a family leadership program. And they developed the curriculum together, they went through it, and then they had a graduation at their children's school. The mayor came, the superintendent came, and the students watched their parents who didn't graduate school, and they were so proud of their parents, and the parents were so proud to be on the stage and to be seen by their children as successes when they themselves in many ways viewed themselves not as successes.
Wow.
And the parents themselves helped to develop the curriculum for this, and then move on for the next year for other parents to participate in that. That's empowerment.
Yeah, absolutely. And that's redefining the parents' experience with their own education.
Absolutely.
And that can make all the difference, because if the parents believe in it, they're teaching that to their kids.
Yeah, exactly.
Yeah. Oh, well, we're running out of time, everybody. I have so enjoyed our time speaking today. Thank you for interacting with us, for viewing today's conversation about eliminating disparities in health and education. Is there anything you'd like to leave our audience with today as they consider just the depth of what's happening here in the College of Community and Public Affairs at Binghamton University?
Yeah, just that I hope you have an appreciation for the passion we have for the work that we're doing, and how lucky we feel to be working with some of your own children in this work, and with some of you as partners in this work. And I would not be anyplace else. This is Binghamton University College of Community and Public Affairs is a dream job for me, and because I really feel like we're making a difference, and to have the exceptional students we have to work with us to do this and move things forward is really a privilege.
Well, we are at our time, and we are so lucky to have spent time with each of you today. I'm inspired by the work that you're both doing in the community, even beyond our amazing campus. It's a great place to be. I work primarily with our liberal arts and science students in my job, but as a doctoral student in CCPA, it's just eye-opening to hear some of what is happening in the college that maybe isn't part of my day-to-day classwork, and something that I could aspire to be a part of. So thank you so much for sharing with all of us. I know that Those of you watching may want to get more involved, and we certainly would love for you to do that. Visit the website for College of Community and Public Affairs and stay in touch with Binghamton University. We're going forward.